Hello, friends. It's wonderful to be here with you once again for Cancer in Our Community, where we're having conversations about improving health outcomes for all members of our community. My name is Dr. Brandon Blue. I'm an oncologist in the Malignant Hematology Program at Moffitt Cancer Center, and I'm also your podcast host. And today we'll be discussing a topic that many people may not consider when they or one of their loved ones is diagnosed with cancer. And that is the idea of a clinical trial. While the U.S. is a wonderful melting pot of many different people from a lot of different backgrounds, there's a lot of us who are really what they call underrepresented when it comes to these types of clinical studies. But what is a clinical trial? Are they safe? Who needs to be in a clinical trial? Why do we even have clinical trials? Well, today is the day to get all those questions answered. And I'm excited because today we also have Delilah Hernandez, who's going to show us all about clinical trials and really her work and involvement of how she goes about clinical trials and actually gets people to participate in them. So stay tuned. Please make sure that you take notes because this is going to be very important information. So, Delilah, how are you doing?
I'm doing great, Dr. Blue. Thank you for having me. I'm excited to be here. How about you?
You know, I'm doing wonderful. I'll say that I'm just excited because I think that we hear about clinical trials. There's a lot of buzzwords about it. So I'm excited for this conversation. I think people will learn a lot today.
Absolutely.
All right. Well, I have to tell people a little bit about yourself. So I'm just going to go through some of your background so people know exactly who they're listening to. They hear the voice, but I want them to know the person behind the voice. Okay?
Mm-hmm.
All right. So I'm just going to let people know where things started years ago. So you received your Bachelor of Science in Health Education from the University of Florida, go Gators, all right?
Go Gators.
And her Master's of Health Science in Mental Health from Johns Hopkins University. Well, at UF, Delilah, you helped co-lead the health education materials development and actually co-train Haitian educators in Cap Haitian, Haiti, and you were also in Haiti from 2017 to 2019, right before the COVID pandemic, through the P4H Global Program. You know, I think for a lot of our returning listeners, this gives us a reminder of last year's episode where we had Dr. Dorothy DeRosier-Mertlis, who really talked about her work within the Haitian community. So it does sound like this is a recurring theme, and it sounds like there's multiple people at Moffitt really making sure that we help all populations of people. But more about you, Delilah. So how you came to Moffitt is really as what they call a clinical trials coordinator in the breast program, again, right before the COVID pandemic in 2019.
Mm-hmm.
Also see that you spent some time as a research project specialist managing tobacco cessation treatment studies for vulnerable and underserved populations within the Tobacco Research and Intervention Program here at Moffitt. Now, you have a great role as a research community health educator with Dr. Susan Vadaparampo. I know that you guys do a lot of work really trying to help improve not only just race and minority populations, but really for all people, making sure that we have equitable access when it comes to clinical trial. But I'll tell you, you've done a lot already. And I'll tell you that I'm really excited to hear about it. You're just such a professional. So I want to just kind of dive right in.
Let's do it. Thank you for sharing that.
Yeah. So, all right. I think the first question that people want to know, when we say clinical trial, people also hear the word research. Mm-hmm. And so I think that it's important to understand from a listener standpoint, and maybe you can educate them, is research the same as clinical trial? What is a clinical trial? Like what? I hear those words, but can you explain the meaning?
Yes, that's a great question, and we do get that when we're out in the community. Some people are more comfortable, I would say, with the term research. One way that we like to explain it is that the research term could be maybe like an umbrella, right? Because there's different types of research. But the clinical trial is like kind of underneath that umbrella, one kind of section of research. And so that's kind of how we explain it too.
So what you're saying is that you can be involved in research, but potentially not have to be in a clinical trial. Is that right?
Correct.
Okay. So can you maybe give me an example? Like if people are like, I've heard about clinical trials, but I don't really know what it is. Can you maybe explain to the listeners what maybe some examples of that, maybe that they've actually seen or heard of before, and maybe not even known that that was a clinical trial?
Absolutely. So, clinical trials are types of research studies that test how well new medical approaches work in people. So, those medical approaches could include surgeries, they can include drugs or treatment, in this case, like cancer treatment, like chemotherapy, and they can even include like different devices. So, maybe if there's like maybe a heart monitor, a new heart monitor that's coming out, or a blood pressure cuff that we're trying to test to see how well it works on people, that can be something else that's tested to see how well it works.
Now, I'll tell you, when you bring up the word new and testing, my heart flutters a little bit, okay, because I'm a little bit nervous, okay? So how do we know that when they're testing these things, you're saying they're doing these clinical trials, like, are there different steps or stages? How do we know that this is something that's safe?
Yes, absolutely. So clinical trials have, I would say, multiple phases, okay? And we have, specifically for a clinical trial, we have 4 different phases. The first phase kind of looks at the like safety and the dosage and the side effects in people. And they start with like a smaller group of people. Then we go into a phase 2 where it also looks at the safety, but also how well it works in people. And then we kind of increase that group of people that it's being looked at as well. And then we go into a third phase. That third phase basically looks at a larger group of people. So maybe like at this point, maybe thousands, okay? And then they confirm how well it works. So they confirm the effectiveness. And then in the fourth phase of the clinical trial, basically this happens after the medical like treatment or the device has been approved. And then researchers look at more of the long-term effects. So I think it's important to know that there is a lot of steps that go into clinical trials, and at each of those steps, like safety is important, how well it works is important, and the rights of participants and patients is important as well.
All right, so I'm gonna summarize for the people, just for the people can understand exactly what you said, because you said some important points there. So it sounds like number one, like the first thing is safety.
Yes.
Like so regardless if it works or not, it needs to be safe.
Yeah.
So that's number one. Okay. So after you find out and say, hey, this is safe, the next thing was, does it actually work? And so you say, all right, well, now that we know, number one, that it's safe, and number two, that it works, it sounds like the third question is it better than what we're already doing? Right? So then you say, all right, I know that it's safe, I know that it works, and I know that it's better than what we already have. Then you even do one more step and say, well, let's make sure there's no long-term side effects. Is that what I'm hearing?
Yes, absolutely.
All right. So it sounds like this research, this clinical trials process is pretty complete, right? Like it's pretty thorough and complex. And it sounds like they've kind of worked out a lot of these kinks. All right. So one thing that I personally hear a lot, because I told you I am an oncologist, which means I see people who have cancer, is that people use the word guinea pig when it comes to these clinical trials, when it comes to people being nervous, that they actually may be getting what they call the sugar pill. You know what I mean? So can you help people understand in these different steps, how does that play into some of those fears?
Absolutely. So that is very common. And when we are out in the community, we actually get those questions too about potentially getting a placebo or being a guinea pig. So I'll start with what you said first, the guinea pig. Most people who say that feel as though maybe they're not in control of their care in a way, and that is false. Like there are definitely rules and guidelines that protect like the rights of participants and patients while they're in the clinical trials. And we also like to reframe that. Instead of using the word guinea pig, because that's completely false, participants in clinical trials can be seen more as pioneers. Like they are the first people to be a part of new groundbreaking science and treatments, and not only potentially help themselves, but help others, whether that's their loved ones or just others in general.
But how do people know that they should even be a part of a clinical trial, right? Like if they're listening and they say, oh my gosh, I heard this podcast, Delilah was talking about this research and something. How do people know if that's for them?
Yeah, that's great. So what happens is is when a patient goes to their doctor and they're learning about their diagnosis and they're potentially given treatment options. Clinical trials should be a part of those treatment options, okay? So whether they ask about them themselves, which we definitely encourage patients to be proactive in their health, or the physician just tells them about them, that's where they will first hear about a clinical trial at times. But then following that, there's what we call an informed consent. And during the informed consent, basically, patients are given all the information and all the details possible about a clinical trial. So during that, they learn about what the study is, they learn the purpose, how long the study is, any potential risk or benefits, how their data may be stored and protected at the same time. They also learn about other treatment options, and basically they're given as much detail as possible so they can then make an informed decision and decide on what's best for their health.
Well, I'll tell you that one of the things that I hear all the time, literally every day, is that people believe that these clinical trials are for when there's nothing else. Say that they went to the doctor and they tried drug A, they tried drug B, they tried drug C, and then they're saying, oh, clinical trial. So I just want to make sure, is that what you're saying this is, or is clinical trial something else?
No, so that's also a misconception that we hear often where it's kind of the last resort, but that's completely false because clinical trials can be offered at any point of their cancer care process. So there's clinical trials to prevent cancer, there's clinical trials to screen for cancer, to treat for cancer, and then there's also trials to maybe improve the quality of life for someone who has been diagnosed with cancer. So it's not a last resort. No, there's options for everyone at any time.
Okay. So what if the people here have sparked their curiosity and they say, oh my gosh, I have, some type of cancer and I'm curious if I'm eligible for some type of clinical trial. Where do they go? How do they know what to even look for? Because maybe they might not see their doctor for another 2-3 months. So what do they do in the meantime?
Yeah, absolutely. So it's nice to sometimes do a quick search, right? Quick Google search. We all have our handy dandy phones. We all have some kind of access for the most part. But you can do a quick search about the type of cancer that you have and maybe clinical trials that are available in the area. So you can do, for example, we can use Moffitt, right? So if someone has breast cancer, they can search up clinical trials at Moffitt. Moffitt has resources where they have the clinical trials highlighted for patients and caregivers who are interested. I would encourage that if you look at this list, write them down, write the ones that are interested, and have that list ready for your next doctor visit to basically, bring up the topic as well if you haven't already heard about it.
Well, I'm glad you brought up Moffitt because I want to talk a little bit more about what you do here.
Yeah.
So I know that we talked a lot about your background and some of the things that you've done in the past, but what are some of the things that you're doing now at Moffitt, especially when it comes to clinical trials and research?
Yeah, so my role at Moffitt, like you said at the beginning, is a research community health educator. So that means that I have the opportunity to be in the community, connect with people, and teach about research, or in this case, clinical trials.
Now, I need a little bit more than that because I know you don't just stand on a corner and say, let's do research. So how do you do what you do? Where do you find these people to educate?
Yeah, absolutely. So I am part of, like you mentioned as well, Dr. Susan Vetter-Prampel's research lab, and we are currently working on a study called Act Wonders. So that's really just a short, cute name for a really long title of a study. But the purpose of this study is to develop and implement interventions that help increase diverse participation on clinical trials.
Well, the next question I'm going to ask is, why does that matter, right? I would say if you need 100 people to be in a clinical trial, why does it matter what they look like or where they come from or any of that other stuff? Why is that important?
Yeah, so while everybody can get some kind of illness or disease, I know specifically for cancer, when we're out in the community, I ask a question. Raise your hand if you or someone you know has been touched by cancer. And most of the time, about 80 or 90% of people raised their hand. When we look around the room, nobody looks the same. Everybody is different. Everybody comes from different backgrounds, ages, gender, race, ethnicities. And so something that I like to highlight is that illness and disease does not discriminate, okay? Now, while we can all, somehow be at risk for cancer, the way that we grew up, our background, our race, ethnicity, or gender could actually affect how we respond to certain treatments.
Got it.
And so it's important for doctors to do clinical trials and do research on different types of people so that we know that whatever is getting approved for treatment actually works for different type of groups.
So you're saying me and you could have the same type of disease, get the same exact treatment, but respond differently.
Absolutely. Yeah.
I see. All right. So that makes sense then. So really, and so then how is Act Wonders doing that? Like, what are you guys doing with this program to help different people get enrolled in these clinical trials? What are you guys doing?
Yep. So we have different interventions that actually reach different levels in the healthcare system. So what does that mean? So we have community outreach and engagement. So that's where I come in, where we educate the community residents. We can go into health centers, rec centers, libraries, wherever it may be, to kind of share important information about clinical trials. Then we have education for community providers who maybe refer to Moffitt and want to refer their patients to clinical trials at Moffitt. And then we have another side of it where we use different digital tools. And these digital tools are meant for the physicians and the providers and the clinical trial coordinators and kind of help them in their development process of the clinical trial as well.
Well, I just want to bring up that when you use the word diverse, that really doesn't just mean race, right? Because I'll tell you that there's people who are in the city of Tampa who are very different than people who are in rural Florida. Or there's people who might have cancer at age 80 who might be different than how we would treat someone who has cancer at age 30. So what types of things are you doing to reach so many different people? I mean, because these are really all the spectrum of people. So how do you guys go to these different places, or how do you find the people who may not necessarily be connected to the healthcare system?
Yeah, so Moffitt covers a large range of Florida. We have what we call like a 23 catchment area. So there's 23 counties in Florida. And so we have focused in those areas on regions that have like high cancer incidences, right? And additionally, race and ethnicities as well. But like you said, it goes beyond that. So we definitely connect with local organizations. So where, the population really is, like where families are, where people are. So that could be local churches, that could be local recreation centers, that can be different health centers in the area. So we go out and introduce ourselves, talk about who we are and what we do at Moffitt, but we also do our best to learn about them and see, is this type of education a need for them? And we work to collaborate and partner in that sense.
Well, I'll tell you, Delilah, we like to keep it honest and what we call keep it 100 on this podcast, okay?
Yes.
So I need you to tell me now, you go into the middle of rural Florida, someone who maybe have never heard of Moffitt and have never heard of research, there has to be some type of either barriers or some type of, how do they look at you? Like, how do you overcome someone who maybe have never even understood the things that you're trying to tell them? So can you give me a breakdown of like, what are some of the things that you're hearing or seeing out there where people are like, stop it, Delilah, I don't want to hear anymore? Or what are some of the things you're seeing?
Yeah, so I think something that's common, especially with the topic of research and clinical trials, is that there may be some mistrust in the area, right? And that mistrust is definitely valid because we've had trials in the past that have been unethical, and many of the populations that we talk to have heard about them. And so the first things first is like, I don't know if I can even trust you, right? The way that we combat that is, one, just learning about them, like acknowledging that this mistrust is valid, acknowledging that their experiences are valid, and learning about, what's important for them. And then also just sharing additional information. So we try to answer as many questions as we can. We try to debunk all the myths that we can. So it's really about that partnership and building that trust first before we can even, do some of these education sessions. So we understand that it may take some time, but presence is important. The more they see a familiar face, the more they see a trusting face, then we kind of get to the next level of like, okay, here's some education that we have available if this is what you'd like.
Do you find that when you go, are most people accepting and like welcoming this type of information? or are people looking at you kind of sideways like, what is she doing here and why is she talking to us about this?
Well, I will say because of Moffitt's reach, many people actually have heard many good things about Moffitt. So we definitely get stories like personal testimonies about a family member or friend or them personally have coming to Moffitt and had a wonderful experience. So, Moffitt in general, I've had people just say, wow, thank you for coming all the way out here, even though you're in Tampa, and so that's rewarding and refreshing. So it really depends. Once we get onto the research topic, then it's a little bit more conversation and relationship building, but overall, I'd say we're pretty welcomed.
Well, I'll tell you, earlier in the conversation, you used the word pioneer, meaning that people who are on these clinical trials and a part of this research really have access to really the latest and the greatest. But is there any other cool things about being on a clinical trial or anything else you can tell people where you're like, yes, you might be the newest kid on the block or the newest medicine on the block, but what else would be some positive things that you could kind of maybe tell the listeners about being on clinical trials or being part of research?
Yeah, absolutely. So as a previous clinical trial coordinator, I've met many patients who appreciate clinical trials because they are closely monitored. So that means they do come to Moffitt or the clinic more often than others who are in a clinical trial. So they appreciate being able to kind of catch any other disease early, any other issues that may have happened. They appreciate being able to share about their maybe side effects or how they're feeling more often. So that's one thing. There's also an opportunity to just learn and adapt new healthy behaviors. So while you're on clinical trials, you're being asked to, do additional tasks. So maybe they're asked to kind of write down how they're feeling. They're asked to confirm when they're taking their medication. And a lot of patients appreciate that. Because of the clinical trial, they're learning how to, create new habits that are helpful for them. And of course, one thing that I do like to encourage and that I've appreciated listening to patients who are in a clinical trial is they've become their own advocates for them and they enjoy sharing their experiences. So they can be an advocate for themselves and for clinical trials, but also be a resource for their family members or friends. And that's definitely something that's really heartfelt and encouraging for me is to hear that patients who have been in a clinical trial then, do want to help others. They do want to be a part of groundbreaking science that does help their loved ones or, maybe their kids or grandkids or cousins if, cancer has ran in their family before.
I'll tell you, as someone who sees people with cancer literally every day, I appreciate something that you said because sometimes I walk in the room, I have my white coat on, and my stethoscope around my neck, and I ask people, hey, how you doing? Guess what's the first thing they say? I'm doing good. But really, it sounds like what you're saying is that as a part of some of these clinical trials, they're actually taking daily journals or really taking an introspective look at exactly how they're doing, really some of the side effects that they completely forgot about and they don't tell me about, but now we have a journal. Now we have it documented and we can actually say, well, you might be doing good today, but what about yesterday? Or what about last week? You know what I mean? And so I do appreciate that because sometimes, I'll be honest with you, people just, they forget, right? Like they want to almost not disappoint me as their cancer doctor, right? Like they want to say, hey, Dr. Blue, this is the plan and I'm doing great. And they want to really kind of show me that they can handle it. And I want to tell people that this is a two-way street. Yes, I'm the doctor, but this is a partnership. You know what I mean? And
Absolutely.
so knowing that you actually are having diarrhea from some of the medicines that I'm prescribing, that's important for me to know, right? And you might even be embarrassed to even talk about some of those things because you might have some family members there with you in the room that you might not even be open to sharing. So writing those down, having that as a journal or having that be a part of research, I think is fantastic, okay? And so
Awesome.
It sounds like there's many benefits to being in the clinical trials other than having the latest and greatest, which does sound really cool because we know that as the years goes on, healthcare is changing, technology is changing, and we get better and better ways of not only curing cancer, but detecting cancer and preventing it.
Absolutely.
So we did a lot of talking, and it's been a great conversation. But I know sometimes when we have a lot of information like this, it's like drinking through a fire hose. And people are like, whoa, Dr. Blue, you and Delilah were great, but it was way, way too much information. I can't really soak it all in. So if you wanted to basically leave our listeners with a main point, like something to not forget, what would you say that thing would be? If you say, hey, if you don't remember anything else from Delilah's mouth, this would be that thing.
Yes, so I think that kind of relates to my last comment about being advocates for clinical trials, but also for themselves as patients. And what I would say is for everyone to be proactive in their care and to attend informational sessions. So to continue to want to learn. So it's okay to have questions. It's okay to have, any kind of skepticism or misconceptions, but I would encourage everyone to seek out helpful information and ask all the questions that they can to be as informed as possible versus kind of shying away from, like you said, even sharing their signs and symptoms or shying away from their doctors who sometimes they just trust because you guys, you have all the information in your heads. You already know everything. So I definitely encourage everyone to ask questions and to keep learning moving forward.
Yeah, I think that what you say makes complete sense because I think people don't really know, but that's also part of our job as doctors is to answer these questions, right? Like there should be no reason where you would leave my visit and then still have to do some type of search.
Right.
It's like, this is the time we're sitting across from each other face to face. Let's ask the questions. And even if you forget something, then you can either write it down, we can save it for the next time, or we can find a way to make sure that your questions get asked. And that's definitely part of my job as being a cancer doctor. So I do appreciate you for saying that.
That's
okay?
awesome.
But it does sound like you're busy. You travel a lot, you give a lot of talks, you're like educator of the year and doing all these things. But like, I want to know more about you kind of as a person. What do you do for fun? What do you do if there's ever any time off? Like, is there anything where you say, all right, when I let down my hair, this is what makes me me?
I love to experience new restaurants and little cafes or different activities that are new to the Tampa Bay area with my family. And I love to salsa dance.
Okay, I'm not letting you get out that easy. If you can show us a move and do,
my
what do they call it? The merengue, a little something. We're going to have to do it just for the listeners. I just want to let you know she's still seated and not doing any salsa dances. So stand up for our listeners just so they can see a little bit of this salsa. Let's see.
We'll do a little side
Okay,
step.
listen, guys, I want to let you know she looks like an expert. So thank you so much.
Awesome.
Look like you do a great job. So I do appreciate that. And I'll tell you that it's always good to get away a little bit. I know Moffitt is work for you, but it's also something that you love and enjoy. But it also is great to have time with family and
Absolutely.
also let your hair down and do some dancing. Okay. All right. So I just want to tell everyone, thank you for your time today, Delilah, for really explaining to us some things that I think some people may have never heard before. I know I learned some things today, and I'm hoping that our listeners learn some things as well. I know that cancer is scary. I know that coming sometimes to a cancer center can be scary. And I do know that sometimes even being involved in research can also be scary, right? So these are really some fears that I think people maybe internalize, but maybe not even talk about. So I'm glad that we're able to have these kind of conversations. But I think some of that fear is just because people don't know and they don't really understand exactly what these things mean. And so I'm really hopeful that people were able to learn something and this can kind of lessen some of those fears. I'll tell you that after hearing this today, I really hope that people consider clinical trials. I just want people to know that these are really amazing opportunities. It's okay to be nervous about them, but it is something that you should, as Delilah mentioned, just talk it over with your doctor, right? Like there should be this relationship with your healthcare team where you say, hey, am I eligible? Are there any clinical trials or research things that I could be a part of that could make my care even better? All right. Well, as always, I just want to let people know that we share the information from this episode in our show notes. Please remember to follow COE on their social media or email them at coe-office@moffitt.org. Until next time, everyone, thank you so much for listening to this week's episode.
Hi, I'm Hunter Dane, Senior Community Health Education Program Specialist here at the Moffitt COE office, and here are some upcoming events where you can find COE in the community near you. Hudson Community Health and Resource Center is hosting their Family Fun Day Spring Festival at Hudson High School on March 14 from 10 a.m. to 2 p.m. Stop by to connect with our team as we provide information about clinical trials at Moffitt and introduce the supportive services and resources available to you and your family. We hope you'll join us for a day of fun, learning, and community. Join us for Project Courage on Wednesday, April 29th from 4 to 5 p.m. at the Sarasota Gulfgate Library. This free one-hour workshop features evidence-based education on ovarian cancer, including risk factors, prevention options, and genetic testing, along with discussion from experts in gynecologic oncology and genetic counseling, and a personalized genetic risk self-assessment. Open to women 18 and older and all who want to learn more, Project Courage is made possible through the generous support of the Gail Baird Foundation, and we encourage you to RSVP on our website and join us. Check out our website or visit our social media page to stay up to date with COE events and announcements. Or to collaborate with us in the community, send us an email at coe-office@moffitt.org. That's coe-office@moffitt.org. We look forward to seeing you out in the community.